strategy, if it's carried out, would lead to more deaths than all of the American war dead in all of the American wars of Donald Trump's lifetime.
Well, Lawrence, good evening, Lawrence. We already have, as you mentioned, proof positive examples in Sweden that this doesn't work. Conceptually, we can debate it all we want. Intellectually, we can debate it. Dr. Atlas and whomever he wants to debate it with, we can have that discussion. But we see what's happening in Sweden, a country like Florida, like the state of Florida, in some cases the state of Georgia, that never really shut down, that kept bars and restaurants open largely, that allowed children and adolescents to go to school. And guess what happened, Lawrence? It didn't protect the nursing home individual, the over 70 individual in Sweden. Sweden has the highest death rate per capita in that part of Europe. They have 6,000 deaths, 1,000 more than China, and they have about 1/100th of the population of the Chinese. So what's happening right now in Sweden is a cautionary tale for any argument regarding herd immunity. And just a quick word for those viewers, we use this word, we use a lot of complicated terminology. Herd immunity is this notion that if enough of the population gets exposed to COVID-19, then that will serve as a bulwark against further population infection surges of the virus, protecting those who have not previously been infected. But it just doesn't work.
Dr. Gupta, what does it mean for public health generally that the Trump administration is considering a plan that could completely flood the system with new COVID patients?
Well, it means that they're essentially pursuing a strategy without any pop-off valve, Lawrence. We don't have more ICU beds. We talked about in March, we still don't have them. We don't have enough PPE for 21 days. So people will die, Lawrence, is the idea here. You estimated at 2 million deaths. People will assuredly die unnecessarily, and we should not have to make that trade-off.